In this film, we're asking, how do we increase an understanding of health information among the general population? With me is Professor Martin McKee. Professor McKee, unregulated social media, of course, is a breeding ground for conspiracy theories and fake news. And unfortunately, this has been highlighted during the COVID-19 pandemic. What are the challenges around increasing people's understanding about information, about what's valid, what's true, what's useful?
Obviously, we would like individuals to be able to make judgments on what's true. We're often dealing with highly complex topics. I think what we have seen with COVID, which is very welcome and is a really quite radical departure, is that the social media companies themselves are actually clamping down, because we do need somebody to help with that. We need to have a mechanism to stop the spread of evidence that is going to be very damaging to health. Now, of course, there is a fundamental difficulty there, because some of that information is being spread by people who are in positions of authority. But at least we have seen Facebook in particular coming out and taking down some of the most misleading messages, although some of us would have hoped that they would have done it rather earlier.
And some of the message, of course, can be rather confusing. On the one hand, we'll hear that we don't need to wear face masks, and then some other report will say that's what we need to be doing. So how can we try to distinguish which is the messages that we should be listening to? How can we navigate our way through sometimes confusing and evolving information?
This is an incredibly difficult challenge. You mentioned face masks, or as I would prefer to call them, face coverings, because I think we're seeing people coming at this from very different directions. One question is, are we looking at these as a means of protecting the wearer, or are we looking at them as a means of protecting other people? And then we also need to ask questions about whether we can apply the evidence that was accumulated in pandemic influenza to coronavirus, which spreads in a different way. That really gives us a requirement to have trusted sources of authority. I don't think it's reasonable to ask individuals to make a judgment on the science, because even those of us who do have a scientific training find it very complex to navigate our way through all of this, and there are trade-offs. This really comes down to the importance of having trust in governments in particular. We have to have trusted authorities who can synthesize that evidence and present it in a way that is credible and which people do actually believe in.
Thank you for taking part, and thank you for watching. Goodbye.